What's going on, everybody? I am Eugene. Eugene does hair, and I am here with Angela Cho, creator and founder of Lady St. Lucia Lashes, and Dr. Assif. We are so excited to have you here today.
Thank
We
you.
are going to talk about acne and acne treatments, something that I can say that almost everybody has dealt with in their life at different times. So, doctor, let's just get into it. Let's talk acne.
Sure. Acne is three things. How we treat it, three things. You have to stop oil production, which is what we call sebum production.
Okay.
Basically, you have to stop the bacterial load, inflammation, and basically you have to open up your pores. So when you open up your pores, there is, bacteria doesn't like oxygen. So like I say again, three things. You have to stop oil production, which is sebum productions, like you see. You have to stop that bacterial infection over there, and you have to normalize your skin exfoliation. We have to open up your pores. So basically, it's very good because also it stops the sebum production. Also, whenever you do topical medication, that when you open up your pores, that topical medication go inside and it helps killing bacteria better than that. Those three things for any treatments. Those the three basic treatments. So yes, Angela, go ahead.
What are some of the major causes for acne breakouts? I know we've mentioned hygiene and things like that. Could be hormonal. I mentioned possibly even having stress breakouts on my forehead and whatnot. What are like the basic main reasons and causes for acne?
Yes. We talked last time. We do like number one is genetics. Remember, I told you thanks my parents for what you give us. So basically sebum production. There is glands. They secrete a lot of oil. When your glands secrete a lot of oil, they block your pores.
Okay.
Blockage for your pores. And then when you block your pores, basically it causes acne, and basically that's number one. So that's why all the time you have to open up your skin, exfoliate your skin as much as you can. Because if you don't exfoliate your skin, bacteria love, especially in the face, love when there is no oxygen. When the pores get clogged, bacteria grow in that environment. That's number one. Of course, hormonal. When we start getting puberty, that's number two for acne. And the third one is hygiene. So it's kind of, you just say it right now. So especially with athletes, working all outside open spaces. And those are the major three things,
Okay.
yeah. So you're going to tell me how basically you're going to treat the acne. Is that correct, Angela? Do you want me
Yeah, I would love for
question?
you to kind of share the general treatment, the ideas and concepts behind a treatment. I know there's multiple levels of treatments that we're going to get into later in the later episodes. But today, I would love to hear, and I think the people who struggle with this condition would love to hear how they can actually manage it and what treatments are possibly readily available for them.
Sure. So I'm just going to go very brief since we're going to be no more than 20-30 minutes. We'll keep it very brief. So like I said earlier, three things. We stop oil production. We open up our pores. We kill the bacteria. The same principles. So number one, there is three things for acne. We can do topical medication, oral medication. Okay. So for topical medication, number one, we wanna get something kills bacteria up on the top. Also, the topical medication that exists right now, there is what we call benzoyl peroxides, and we can do topical antibiotics with erythromycin and tetracycline. Usually we combine. We don't like to use one topical antibiotics because it may be resistance. So we like to combine like benzoyl peroxides with antibiotics. And actually there is treatment that combine benzoyl peroxide and topical antibiotics. That's very important. Topical antibiotics are very important to kill the bacteria, like I said earlier. What is number two? Number two is we have to use something to exfoliate your skin, open up your skin. It's retinoic acids. Retinoic acids are very important because they exfoliate your your skin, they open up your pores. Actually, when they open up your pores, it makes those topical antibiotics go inside. So those are very good treatments. So again, when you have bacteria, you have inflammation. A lot of kids, they don't want to have this hyperpigmentation, because whenever you have inflammation from the bacteria, you're going to have some inflammation cause hyperpigmentation. We like to combine some acids. So basically, you can clean up your face with, when you start, you can clean up your face with acids. Acids, you can clean up your face with, there is different acids. There is azelaic acid, there is glycolic acids, there is all the acids. So one of the most famous actually acids are what we call over here the azelaic acids. You know, azelaic acids that you see in here. Do you see my dish?
Yeah.
Mm-hmm.
But there is glycolic acid. Actually, in fact, I have this one over here. Let me show you. That, like, like this one. It's let's see in here. I'm sorry. This glycolic acids. You see in here. You can clean up your face. And the good thing about this one, the acids also, it does stop the sebum production, the oil production, but also it stops the melanin release. So it doesn't, when there is, like I say, there is a phenomenon, what we call post-inflammatory hyperpigmentation. Whenever there is inflammation, it's going to be hyperpigmentation, which is darkness. That's what you see. A lot of kids, they have acne, they have spots, dark spots from acne, and that's really bad.
Yeah.
So these acids are really good for not to have this, these spots, acne spots. So like I say, you're gonna clean up your face with those acids. Like I said, there is a lot of them. Azelaic acid, whenever you see acids. And actually, your question, Angela, earlier, you can use like apple cider vinegar acids just to clean up your face with.
Now, doctor, when you
yes.
when you say that, like, do they just put the apple cider vinegar on a cloth and wipe it over their face, or do they wash
Very
their
good
face
question,
first
Eugene.
and then do that?
Very, very good. Yeah, very good question, Eugene. I'm glad that you asked me that question. Basically, what do you do whenever you put like one, you're gonna dilute it with the 2/3. Whatever amount that you put in that, you dilute it 2/3, like 1/3, 2/3 with water.
Okay.
So, like for example, we have spoon one. You're gonna put 2 other spoon waters. You know what it is.
Okay.
So 1/2 you dilute it with 2/3. So we don't want to like just put it in your face. You know what it is.
Yeah.
So it's very. So if you put 1 spoon of apple cider, you put 2 other spoon of water. 1/3, 2/3 of water. That's a very good question. So you don't want to put in that. So and after that you clean up, and also you can use that also salicylic acid. There is a lot of products that have also salicylic acid, which is also good for that. Glycolic acid. You know what it is? Acids are good for hyperpigmentation. Just remember that. Even if you don't have acne, if you have any hyperpigmentation, acids are good because they stop the melanin productions. So again, okay, Angela, go ahead for it.
I have dark spots on my face too from acne from years ago.
Yes.
And just getting older and the sunspots and things like that. Now, for someone who is interested in using a home remedy such as the apple cider vinegar, how often should they actually apply that to their face or as a part of their regimen?
Oh, they can apply it every day. It's not a big deal. In the morning and in the afternoon, they can apply it every day. It's just like diluted. It's great. And remember, acids, the results usually is not within 1 week. Usually it takes about at least 3 months to work. Okay. Because that phenomenon, the hyper, but it's good to have it. It's not like you're gonna apply it and actually it's been very popular, actually can clear up your face. The apple cider vinegar right now, a lot of people are doing it. It can clear up your face basically. And it's not even acne. You can bleach it's not bleaching, but stop that inflammation. A lot of people are doing it even without acne. Just let you know about that. Okay. So again, I'll come back. We do like a bacterial, which is benzoyl peroxides, with some topical antibiotics. We clean up our face with acids, like I say, and we put retinoic acid, which is retinoic acid. There is different brand, retinoic, just generic name is cheaper. And basically it opens up your face. The only thing with retinoic acids, usually it causes some dryness and some erythema, which is redness, and also can cause basically sun sensitivity. So whenever you put retinoic acid, it's better to put it at night, because during the days, like you may be too sensitive for the sun, especially we live in California. So
Yeah.
be honest with you, those three things I'm telling you, topical, retinoic acids, clean up your acids, and really those are the basic for any, of course, you clean up your face. Basically, those are really good if you just do those three things. So it's not like something like crazy you can do what I'm just telling you right now. So okay, Angela, any questions for me besides that topic? Anybody? Go ahead.
So in case that someone can't afford, treatments, what is there any other like alternatives? Like we talked about the apple cider vinegar, that's obviously easy to obtain. Topical things like that. So are there other alternatives besides those two that people can kind of look for?
That's right. Be honest, retinoic acids are, there is like there is pills, like, chemical pills. Personally, I don't know, like exfoliations of something that can exfoliate your skin. I'm not sure about what kind of medicine, but whatever exfoliate your skin is good for you. You do chemical peel, whatever exfoliate, but whenever you have acne, exfoliation is a big part of the treatment. And the reason why, because like I say again and again, open up your face. When you open up your face, your pore open up. And when your pores open up, bacteria don't like oxygen. Bacteria lives in state we call anaerobic. When it's anaerobic, means no oxygen. Aerobic means oxygen. So whenever you open up your face and it's oxygenated, bacteria don't like it. So again, and also when you have acne, you can avoid as much as makeup. Whatever cause blockage for your skin, it's not good for your acne. So as much as you can avoid the acne, anything makeup, that must be big. But again, this is for regular acne, but we're talking about different acne. Sometimes you may need some oral antibiotics. Let's say you do like whatever you're doing here and you still have acne, you may need some oral antibiotics. Oral antibiotics, the best for oral antibiotics, it's tetracycline. Erythromycin is not that great because they give you, it's not, but tetracycline is the best. You can start from 500 milligram to 1 gram a day, but that's like the best treatment for basically as an antibiotic beside the topical antibiotics.
Now, on that type of an antibiotic, how long does it take of taking it where you start seeing the results, doctor?
Yes, that's also very good questions. So let me go in there so we can see. So for oral antibiotics, so like I said, usually between the pen of 500 to 1 gram, and usually it takes about 1 month to, usually you're gonna control it 1 to 2 months before you start seeing. Remember, the acne is not like just you're gonna do it today, tomorrow is gonna go away. Acne takes about time because it's not a simple process. So and usually you start the treatment within 2 months, you start seeing the result. 1 month, 2 months, and then after that, when you start seeing the result, you can lower the dose of antibiotics. If you're taking 1 gram, you can just take in, but it's gonna take you a long time before you see and maintenance of antibiotics may be a long time, maybe 6 months like that, but you're gonna lower the dose, so just to get the antibiotics, in control.
Okay. So we were just talking about exfoliation. So there's a lot of people that like to come up with their own home remedies and things like that. A common thing that I have seen people do is either use sugar or salt as the exfoliant agent. In that case, specifically something like salt, is that good? Would that be beneficial or kind of hazardous for the skin if somebody was to scrub their face with salt thinking that it would help exfoliate?
Well, most of the exfoliants is acids. Acids are the best because acids are good in a way, like I said earlier, they kind of a little bit stop that sebum, that oil, but also exfoliate your skin. And also it's good for hyperpigmentation. Be honest with you, is like kind of like we'll talk about the pills. The pills are chemical pills are great, but exactly the salt itself, I'm not sure. I can't tell you. I don't have experience with that, but I'll be honest with you. I'm not sure. I'm not sure. I'm not sure about just doing salt itself, because a lot of these exfoliations is kind of a little bit depend. Doesn't have to be very harsh also for your skin. You know what it is. It doesn't have that much side effects. It has to be kind of, in the same thing, exfoliating skin, but at the same token, we're talking about safer exfoliations, not like putting salt. But I don't have experience. And Angela, do you know anything about salt exfoliations or something?
I personally don't. I have used salt scrubs and sugar scrubs like on my body, and the lab that I used to work for, we used to make salt scrubs and sugar scrubs. But I've had very few experiences in them developing scrubs with sugar or salt, but it was mainly for the body. I have seen products made.
That's right. That's what I was gonna tell. Probably salt and sugar scrub, probably for just a regular exfoliation. Probably just for like somebody, like anybody of the day that just exfoliate, because exfoliating your skin is good even you don't have acne. But for acne, may be different. Maybe not the best. You may have specific things to exfoliate, because that exfoliation needs some acid on it. That helps get that inflammation away and stop that sebum production. Okay. That's why they act. That's why even in the pills, so if you go for pills, for example, there is pills only for acne. Like you go all the pills, even chemical pills, you're gonna see this chemical pill for acne, this chemical pill for regular skin. Exfoliations are made for different type of skin.
Okay. Another question that I had is, specific things that we might consume or eat and ingest. Is there anything specific that we should avoid in our personal diets that might cause, further infections with, acne?
Sure. Yeah, great question, Angela. Like I say, the source of all acne is oil production. So you don't want to eat any fried food. You don't eat anything that cause more oil production in your skin. Okay. So you really don't want, even if you have oil, but you don't want to eat any. So eating healthy, that we're gonna help a lot. So of course you don't want to eat all dairy foods like cheese and all this like almond, like oil kind of. You want to eat healthy. I think because you already have oil production in your skin genetically, you don't want to make it get worse. So eating healthy, vegetables, drinking water, work out, because when you work out, you open up your skin, you go it's very nice workout for you. And of course, when you work out, you're going to clean up, like I talked last time, you cannot just work out and keep that, that sweat in on your face. So eating healthy definitely will help your skin. If you eat bad habit foods, will exaggerate your acne skin.
Okay.
So, and you said earlier too, with like the skin, some of the problems is the inflammation. So I'm assuming then foods that are naturally anti-inflammatory would also be good for you then.
Definitely. Well, most of the veggies are anti-inflammatory things. That's why my point. So anything like veggies I'll be honest with you, there are a lot of veggies are anti-inflammatory out there, and that's what helps. You eating fried food, you eating anything that are not good, it's itself will increase. And there is a lot of food we do that increase inflammation in your system, just let you know. And I'm not going to go through all different food, but one thing I'm going to tell you, your body, when you're eating healthy, your body will recognize if you're eating healthy or not. But eating healthy food is really very important when you have an acne problem.
Okay. There's a lot of, speaking of food, there are a lot of speculations, and it's kind of been trending that food sources like turmeric is good for inflammation.
That's right.
There's a lot of products that have
there's a lot of, that's right,
and things like that.
Antioxidant, yes.
Would that be good?
Of course, anything that antioxidant in it, it's very good because what it is, it helps your skin heal. Anything that helps your skin heals, anything that cause lower that oil production, that would be very helpful. And you know what? Sometimes you can recognize yourself. You know, sometimes when you start eating, say, oh, okay, I don't have acne. You can recognize when you start eating healthy, you will see it. When you eat bad food, you will see it. And a lot of happen when you have an acne, you get a lot of stress, you get a lot of insecurity. So people, they start eating a bad food just like because they don't feel good about themselves.
It becomes a cycle almost.
That's
it
right.
Almost becomes a cycle.
That's right, because they don't feel good about themselves. So, I have acne. What is going to do if I eat good or bad? Doesn't going to help me. So they start eating like, well, I'm like, it's just insecure. So you're right. That cycle, when you start food and they start eating sometimes, but be honest with you, you know, sometimes even, let's not even forget about the acne. Sometimes if you eat healthy, your skin starts looking good by just eating healthy. That's not even talking about acne. And be honest with you. And sometimes you will realize it. Sometimes you will say, okay, what happened to me? My skin looks good. Well, probably just you're eating healthier.
Okay. So yeah,
So
your diet really does have a major impact on.
Definitely, eating healthy has a major effect on you. I'm not telling you your acne is gonna go away, but definitely it's gonna help a lot. You know.
Yeah. Okay, that's definitely helpful too. Eugene, did you have another question?
When we talk about like the basic treatments, now some of these that you talked about, the topical treatments, if somebody went in and got a topical treatment, how long is that service last? Is it a 30-minute process, an hour process? Because I think some people too.
Like how long it takes to do that topical treatment?
Yes.
It's easy. It's like take like less than a minute. So basically, what it is,
okay,
it's just basically, like I say, you clean up yourself with acids, like any acid glycolic. You know, you clean up, and then after that, you just put like topical. Sometimes there is combination between, like I say, peroxide, benzoyl peroxide, and antibiotics. There's actually some combination of treatment, which is, I'll show it to you right now. Topical antibiotics, treatment, and there is combination. Like for example, you see there is benzoyl with either erythro or clindamycin. You just put it over in there, and also there is right now tritonic acid, which is the retinoic acid with clindamycin. It's called Velac. So, and also there is a tritonic acid with salicylic acid. So basically, some of them, they are combined, or you put tritonic, one or two. You this, of course, and you put the sunscreen over that. Because whenever you want to put like retinoic acid, you want to put sunscreen. Remember, retinoic acid are very sensitive to sunscreen. And if this, what I'm telling you, doesn't work, remember, you add oral antibiotics, and oral antibiotics, the best for it is tetracycline, which is like we talk, is doxycycline or something like that, which is in here. You see, there is monocycline, but I like doxycycline. It's much better, oral doxycycline, which is, like I say, you do between 500 and 1 gram. That's the basic. And just doing this, of course, eating healthy, of course, hygiene, very good hygiene, that will really reduce your acne by 50 to 80%. Of course, if you have severe acne or bad acne, then we're gonna probably next time we'll talk next time tomorrow we'll talk about Accutane, which is like very very good. It's oral, but you need like you need to a lot of lab work, and also we have hormonal therapy for like that. For tomorrow, like there's hormonal therapy also. Those are, if you wanna, we can there is also women with polycystic ovarian syndrome that they may need hormonal therapy, and that's an advanced acne therapy. Probably we can talk about that tomorrow, I guess.
Yeah. So go ahead.
No, I was going to say, Doctor, this has all been such great information. I'm just excited that we're starting this series, because I know as we go on, clients are going to start asking more and more questions, wanting to know about more of the intense therapies, which we'll go into later. I'm just saying thank you so much for all that you've already shared.
Yeah, thank you. And probably tomorrow, whatever we can go for this, we can talk about Accutane, which is really something that has to be prescribed by the doctors. And you know, you can have it. Everybody can have. You cannot be pregnant. You have to, you know, get your labs and all this stuff. Also, there's hormone therapy. Then another session, we're gonna talk about mechanical acne, which is using laser, red light, blue light, different laser.
I'm excited to hear about that. I think that's going to be interesting to hear about. Angela, did you have another question?
No, he basically answered it. I was just going to ask if this was readily available to people or if it was prescription only. But obviously the next topic we're going to talk about on the next episode is the advanced treatments for acne. So I'm assuming those would be by prescription, but we'll definitely cover that. Yeah, I'm hoping that the audience would have more questions. For this video, we're going to be putting the doctor's website on the link, and then you'll obviously have this video also on your personal YouTube channels and stuff too. So what is the best way to reach you, doctor?
Well, be honest with you, I can have, they can call my business, like we can have virtual consultations, like, you know, if somebody want to talk to me about,
okay,
you can virtual, and they can call my office, my business office.
Okay.
Is, I think is 949-466-3173.
Okay, and we'll put that information up on all platforms that we're going to be sharing.
Yeah, and anybody can call me, and you can, if you want to ask questions, I'll be happy to answer his question.
Okay, perfect. All right.
I think it's awesome that now we're able to do all this virtually and still get information out to clients. Doctor, thank you so much for tuning in with us. Thank you for our audience for tuning in. Thank you, Angela, for being here. And again, Dr. Assif and Angela and I will be back again in the future, and we will go over more advanced treatments. And if you guys have questions out there in the audience, please send it to one of us. We want to answer your questions, and that's what we're here for. So.
Okay, well, thank you for having me. We'll keep up. Okay.
Thank you.
Thank you. Thank you so much. Thank you.